Hi there, I'm Bernadette Wagner, the Community Outreach Coordinator for Hospice of Washington County. And on behalf of this compassionate and caring organization, it's my pleasure to welcome you to today's episode of Healing, Hope, and Health. It gives me great pleasure to introduce Kyle Adelmeyer, one of Hospice of Washington County's Hospice Care Consultants. Kyle, who has been with Hospice of Washington County for 6 months now, received his bachelor's degree in healthcare management from Southern New Hampshire University in 2012. His previous work experience includes serving as Director of Admissions at several long-term care facilities, as well as working as a community liaison at a hospice in Pennsylvania. Kyle and the other consultants at Hospice of Washington County work tirelessly to meet the needs of those with life-limiting illnesses. Throughout the county, the consultants inform, educate, and explain the services provided by Hospice of Washington County to physicians, patients, their family members, and the community groups. They host events designed to connect those they serve with available resources and strive to build positive relationships with other members of the healthcare community. Kyle, thanks for being here today. I really glad you're here.
Thanks for having me. I appreciate it.
Sure. So Kyle, can you give our viewers a brief overview of the information that you share when you talk to these community groups and physicians about the services provided by hospice?
Typically what we do is we try and provide as much information as we can about all the services that we provide for patients wherever they reside. In a private residence at their home, or maybe they reside in a facility like an assisted living or a skilled nursing facility. So we educate them about the roles that each member of the team has and all of the services that we're able to provide at each location.
Okay, so when you're talking about providing services, they provide medical care, but they also provide equipment and...
Yeah, nursing care, durable medical equipment, and nursing care is going to be from a registered nurse, certified nurse aide, any type of durable medical equipment that a patient may need to be able to meet whatever their medical needs would be.
And you help make those, or the team make sure that they get the equipment and the medications and delivered to their home or the facilities or wherever.
Absolutely.
That's great. So Hospice of Washington County, you said that they have different team members. Can you talk about each team's role and how they work to support the patient and the family?
Absolutely. So we have a registered nurse case manager. That person really navigates and oversees the patient's care, and everything kind of runs and flows through them. And we have certified nurse aides that help provide direct care to patients as well. Social workers that help meet some of the psychosocial needs for the patient as well as the family. We have chaplains for spiritual needs for the patients, and we also work with bereavement coordinators and volunteers that help meet patient needs as well.
So they're really sort of surrounded 360 by a lot of support.
They really are.
That's great. That's great. As a consultant, you strive to let those know those who are dealing with a life-limiting illness that they're not alone. How many people on an average day does Hospice of Washington County serve?
Typically we serve anywhere between 230 and 250 patients a day.
Wow, that's a lot of people that we're caring for. That's great. And what do you tell folks who are in need of hospice care but then don't seek it because they're concerned that they don't have the insurance or the financial resources?
Typically what we do is we try and provide them with as many options as possible. And at Hospice of Washington County, we have a benevolence fund where we're able to provide charity care on an as-needed basis. And last year, Hospice of Washington County was able to provide over $300,000 in charity care to those unable to pay for hospice care.
So basically, folks who are in need of hospice care, there are resources within the community that can help them, and also Hospice of Washington County's Benevolence Fund does that.
Correct.
So that's really a tremendous asset.
It is. It is a tremendous asset, and it is very resourceful and helpful to families and patients in need.
And I'm sure at a time when they're feeling so overwhelmed with the physical and mental aspects of dealing with the disease, not to have to worry about the financial part must be a real blessing.
It really does help lift a huge burden.
That's great. That's great. So Kyle, on a personal level, do you feel a sense of satisfaction and reward shepherding people through this process? What do you get out of your job?
Absolutely. I find this job incredibly rewarding, and mostly because I feel that end-of-life care deserves just as much as loving, tender care as the beginning of life does.
Right.
You know, so being able to shepherd someone and patients and families through this process, to me, is just as rewarding as someone working in pediatrics, for example, and welcoming someone into this world. Someone deserves just as much as love and compassion as care whenever they leave this world as well. So for me, that's really what is one of the most rewarding parts of my job.
And do you have a personal story that you go back and you recall to try to recharge your battery? Because I imagine sometimes it also can be a difficult work.
I did have a family member that experienced hospice care, and they were in a hospice house, which will be similar to what Doey's house will be. And it was well before I worked in hospice care, and I remember the experience that I had working with the members of the team that came in and provided that care, and everyone that I got to meet that worked with us and also worked with her. And for me, that's what really made me realize the importance of hospice and the role that people have in making it a much easier process, I think. And for me, that kind of is what helps recharge my battery and brings me back to the core mission of what we do.
That's great. Well, thank you so much for being here today.
Thanks for having me. It's my pleasure.
Sure. I'd like to thank Kyle for making time in his busy schedule to talk about the services provided by Hospice of Washington County to those with limited time. I'd also like to thank our colleagues at Hospice of Washington County who recognize, for those with limited time, the importance of making every single day count. In addition to providing excellent care, they offer patient, gentle words of encouragement, perform small acts of kindness, and bear witness to lives well lived. In so doing, they remind me of the words spoken by Mother Teresa, who said, quote, "It's not how much you do, but how much love you put into the doing." The actions of my colleagues at Hospice of Washington County speak louder than words, and I'm proud to work alongside Kyle and the others who make a difference every day. Stay tuned, we'll be right back after this message.